Hello, my name is Muriel Mora, medical student. I'm going to tell you about frontal sinusitis causing epidural abscess and Puffy tumor. Definition is when the sinus cavity bends your forehead becomes inflamed. It is common and acute frontal sinusitis. Sinusitis can become inflamed if the mucous membranes produce too much mucus. Infection and other health conditions can also sometimes cause acute frontal sinusitis. Epidural abscess. An epidural abscess is a collection of pus between the outer covering of the brain and spinal covering the bones of the skull or spine. The abscess causes slits in the area. Puffy tumor is a rare clinical entity characterized by osteomyelitis of the frontal bone and association with supraorbital abscess. Usually related to frontal sinusitis in transcranial station is a potential complication.
Please come to edxavideo.com.
Epidural abscess. An epidural abscess is a collection of pus or infected material between the outer layer covering the brain and the spinal cord and the bones of the skulls or spine. The abscess causes swelling in that area. Causes, incidence, and risk factors associated with epidural abscess. First, epidural abscess is a rare disorder caused by infection in the area between the bones of the skull or spine and the membranes covering the brain and spinal cord, the meninges. This infection is called an intracranial epidural abscess if it's inside of the skull area, or a spinal epidural abscess if it is found in the spine area. Most of them are located in the spine. The infection is usually caused by bacteria. Staphylococcus aureus is the most common organism, but may be caused by fungus. It can be due to other infections in the body or germs that spread through the blood. However, in some patients, no other source of infection is found. In the case of an intracranial epidural abscess within the skull, the risk factors include chronic ear infections, chronic sinusitis, head injury, mastoiditis, recent surgery. A spinal epidural abscess may be seen in patients with a history of back surgery or invasive procedures like epidurals and injections. Bloodstream infections like boils, especially in the back or scalp. Bone infections of the spine or vertebral osteomyelitis. And people who inject drugs are also at increased risk of this disease. Symptoms: spinal epidural abscess, bowel or bladder incontinence, difficulty urinating or unable to urinate, fever and back pain. The symptoms of intracranial epidural abscess include fever, headache, lethargy, nausea and vomiting, and pain at the site of recent surgery that gets worse, especially if fever is present. Neurological symptoms depend on the location of the abscess and may include decreased ability to move any one area of the body, loss of sensation in any area of the body, or abnormal changes in sensation, weakness. What are the signs and tests for epidural abscess? The healthcare provider will perform an exam to look for a loss of function, such as movement or sensation. Tests that may be done include a complete blood cell count, or CBC, a blood culture, a CT scan of the head or spine, an MRI of the head or spine. What is the treatment? The goal of treatment is to cure the infection and reduce the risk of permanent damage. Treatment usually includes antibiotics and surgery. In rare cases, antibiotics alone are used. Antibiotics are usually given through a vein or IV for at least 4 to 6 weeks. However, some people may need to take them for a longer time, depending on the type of bacteria and severity of the disease. Surgery is usually needed to drain or remove the abscess. In addition, surgery is often needed to reduce pressure on the spinal cord or brain to prevent further loss of function. What are the expectations or prognosis of this disease? Early diagnosis and treatment greatly improves the chance of a good outcome. Once weakness, paralysis, or sensation changes occur, the chances of recovering lost function are reduced. Permanent nervous system damage or death may occur. Complications. Complications include brain abscess, brain damage, bone infection or osteomyelitis, chronic back pain, meningitis, and a recurrence of the infection, common even if the disorder is treated, and spinal cord abscesses. You must call your healthcare provider if you have persistent back pain with a fever, a headache with a fever, or other symptoms of epidural abscess as discussed before. An epidural abscess is a medical emergency. You must be seen and treated in the emergency department setting and possibly admitted to the hospital. This is it for my discussion of epidural abscess. Thank you. Bye-bye.
Application in medicine. Puffy have no deficit symptoms of sinusitis by have headache and fluctuating fever for 3 weeks. He was no neurologic deficit or abnormality on psychological examination. A blue chemical profile is no reactive protein level of 29 and the fairly direct and cell count of 11,900 per cubic millimeter. Compared to model of regulation unilateral opacification of the left frontal and remote sinusitis, as well as deficit in the frontal bone.
So let's talk about the diagnosis of sinusitis. Being a pretty common disease, you may have gone to the doctor yourself and had the diagnosis of sinusitis. And you may have noticed there weren't a lot of fancy tests or labs or anything like that. That's because, by and large, the diagnosis of sinusitis is made by symptoms alone. And I'll remind you, the main symptoms of sinusitis are nasal or postnasal drip, sinus pain or pressure, nasal congestion, or a decreased ability to smell. There are some other symptoms that may be present as well. For instance, a cough, particularly a cough that's worse when lying down, a headache, ear pain or pressure, and fevers. So if you're showing enough of these symptoms, you can be given the diagnosis of sinusitis. But sometimes the symptoms aren't entirely clear-cut, or something is just a little bit off about the way the symptoms are coming together. In that case, there are some other tests that can be done to diagnose. Sometimes a practitioner will actually look inside your nose to get a look at that nasal or postnasal drip, and that's called rhinoscopy. Remember, the root word rhino means nose. Now, x-rays have been done in the past and are still occasionally performed, but by and large, x-rays aren't really recommended because they're not very sensitive for sinusitis, especially sinusitis of the anterior ethmoid sinuses, just because those don't show up very well on x-rays. So I'll put a little not recommended here. Now, the gold standard for diagnosing sinus disease is a CT scan or a CAT scan. This is very, very sensitive for sinus disease. So let's jump over to a normal CAT scan of somebody's sinuses to take a look at what it looks like, and then we'll look at an abnormal one. So this is an axial image, in other words, a cut through the patient's sinuses as if you were looking down in them from the top. And this image over here is a coronal image, as if you were looking at them from the front. And I'll just point out a couple of the sinuses here. This is a normal maxillary sinus. We can see that on the other side here. And we have some ethmoid sinuses up here. Note on these images that they're filled in with black. That's air, or basically empty sinuses, which is the way they ought to be. So let's go to an abnormal scan. Here we have the same two images, one in axial and the other in coronal. And you can see the same sinuses. The maxillary sinuses here and the ethmoid sinuses here. But notice they're not entirely filled in with black now. They have this rim of gray tissue that surrounds it. And in the case of the ethmoids, completely fills them in. That gray tissue is the inflamed mucosa. So let's go back. And I'll just remind you that most of the time the diagnosis is made over here with symptoms alone. And these other tests are only if needed in special circumstances. But there's a little bit of a wrinkle when you're diagnosing sinusitis. And that is that there are multiple different types of sinusitis. We'll just erase this here to give us a little bit of space. Those different types of sinusitis are split and defined based on the time frame of the symptoms, based on the time frame of the disease. So here I'm going to make a little chart and I'll label my axes. This up and down y-axis we will plot the symptoms on, and the x-axis is time. And we'll put some labels down here, roughly about here, and I'll call this 4 weeks, 8 weeks, 12 weeks, 16. So in the y-axis I've said we're plotting symptoms, and that's just a generic symptoms. It could be any of the symptoms that we've listed over here. And this is just how long the symptoms have been going on in any particular patient. So let's say the symptoms have lasted under 4 weeks. We're about right here. Anything in this time frame is called acute sinusitis. But sometimes the symptoms last longer than that, and they might wax and wane a little bit, but generally are pretty steady over the course of 12 weeks. So if it's more than 4 weeks but under 12 weeks, this is subacute. And if the symptoms last beyond that, out indefinitely, this is chronic sinusitis. And this will make a difference in a little bit when we talk about treatment. But before we can talk about treatment, we have to puzzle out one more thing about the sinusitis in question, because it's going to have a big impact on how we treat it.
Pros and cons. Pros. Analgesics for pain nasal was saline solution. Intranasal, corticoids or nasal. The congestion, it may be helpful. And some more serious cases, short course of oral corticoids can be very helpful. Cons. The patient was treated by intravenous antibiotics for 44 weeks after surgery. Possibility of the frontal bone association should result those usually related to frontal sinusitis, intracranial station, and some potential complications.
Guys, there is specifically a terminology for you to know here in complications of sinusitis, right? Basically, here there is a term called as Pott's Puffy tumor. This one, Pott's Puffy tumor. Okay, it is complication of sinusitis. So basically, look at this one here. So in complications of sinusitis, as a local complication, there can be osteomyelitis, that is infection of bone marrow, right? Osteomyelitis, itis is any inflammation. So here there is infection of bone marrow. If it is of the frontal bone, there is a terminology called as Pott's Puffy tumor. Just remember that this is not any, it's just pus, okay, it's nothing else. So if you can understand in this diagram, okay, where is the bone? Bone is pretty clear for you, right? This thing is the bone. So this is the bone, right? Over the bone you have a fine layer, that is periosteum, right? So beneath this periosteum, if there is pus formation because of the sinusitis, right? So you can see the periosteum here. See this is the periosteum separated from the bone now. This is the bone, and between these two you can see the yellow, right? That's the pus, and that is nothing but the Pott's Puffy tumor. So Pott's Puffy tumor is what? It's nothing but pus, pee, pus. It is nothing cancerous and all that, okay? It's just pus, okay? So the person will arrive with a nice swelling here, like this, okay? That's Pott's Puffy tumor. If it is beneath the periosteum, it is Pott's Puffy tumor. If it is behind the bone, what is it? It is extradural abscess. If it is after the dura, it is subdural abscess. Inflammation of the meninges, so it will become meningitis, and then much deep inside we are talking about brain abscess. And also there can be cavernous sinus thrombosis. Okay, so those will become the intracranial complications. But basically here local complication itself is, they are saying, is Pott's Puffy tumor. So here there seem to be nice images of Pott's Puffy tumor. So hope you have understood this terminology, Pott's Puffy tumor. What is there in the pot? Pus. Okay.
Used athlete in Ecuador. The average number of common cold influenza in adults is 2 to 4 per year, and in children 6 to 10 episodes per year, of which only 2 to 2% are complicated by acute bacterial rhinitis. In children, the proportion may be somewhat older.
So, acute sinusitis is common, but it's most commonly caused by viruses. And I just want to point out that children and those adults who have small children know this very well. Children get the common cold 5 to 7 times each year, and so do their parents. Now, adults who don't have small children will get 2 to 3 colds a year. You probably can document on your own experience. I want to point out, however, how uncommon complicating bacterial sinusitis is. Only 6 to 13% of kids get bacterial sinusitis, even though they get 5 to 7 common colds a year. So that's pretty unusual. And adults get bacterial sinusitis from 0.2 to 2.5% of the time. So most of the time when an adult comes into the office complaining of nasal congestion and having purulent nasal secretions, they still have the common cold. They don't have bacterial sinusitis. And it's overdiagnosed, and it certainly is overtreated with antibiotics.
Conclusion. Sinusitis is a common pathology in pediatrics and generally presents a combination of an infection of the upper respiratory tract. Post-inflammatory tumor is a current rare complication of frontal sinusitis. Early diagnosis and timely medical urea treatment are essential to avoid devastating neurologic sequelae of events of patients suffering from this pathology.
Does it feel like someone is pressing down hard on your forehead? Do you feel intense pain and pressure behind your eyes? You could have sinusitis, swollen, inflamed sinuses caused by an infection. Let's talk about sinusitis. These are your sinuses, the passageways that lie behind your forehead, eyes, and cheeks. They're lined with mucous membranes, which produce the mucus, or snot, that flows freely from your nose when you're sick. So what causes sinusitis? Normally, air moves through your sinuses, but if you have a cold, allergies, or a condition that prevents the little hairs in your sinuses from sweeping out mucus, you could end up with too much of the sticky stuff. That extra mucus can block your sinuses like this. Then bacteria and other germs can start to grow inside your sinuses, leading to that pain and pressure you feel. If your symptoms go away within a month, you've got acute or short-term sinusitis. But if they last 3 months or longer, you've got chronic sinusitis, and that means your pain and pressure could stick with you unless you get treated. What are the signs of having sinusitis? If you've just gotten over a cold or other illness and your forehead and eyes are throbbing with a pressure-like pain, you could have sinusitis. Other signs are tenderness in your face or teeth, fever, tiredness, cough, and a stuffed nose. Your doctor can often tell whether you have sinusitis by looking in your nose, shining a light against your sinuses, or tapping over the area to look for signs of swelling and infection. If your doctor thinks you may need surgery for your sinusitis, or the diagnosis isn't clear, you could also have an X-ray, CT, or MRI scan. There's a good chance your infection will go away on its own if you have acute sinusitis. But if it lingers and you're running a high fever or you're in a lot of pain, your doctor may prescribe antibiotics. You can manage your sinusitis at home with a few easy tips. Hold a warm, moist washcloth to your face a few times a day. Drink extra water and other fluids to thin out your mucus. Breathe in the steam from a hot shower and use a neti pot or saline nose spray. After 3 months, if you're still dealing with sinusitis symptoms, your doctor may recommend seeing an ear, nose, and throat doctor. You might need surgery to drain your clogged sinuses. Most of the time, sinusitis goes away on its own without any treatment. To prevent your sinuses from getting clogged in the first place, avoid getting colds and other infections. Avoid exposure to allergens or irritants such as tobacco smoke. Eat a healthy diet filled with antioxidant-rich fruits and vegetables. Get your annual flu shot and wash your hands throughout the day to avoid germs. When you do get sick, consider decongestant sprays to shrink the linings in your nose and sinuses, and drink plenty of fluids to keep mucus moving along.
Thank you.